So today we have a patient that's 2 weeks post-op of an ACL reconstruction surgery, and we found in our initial eval that she has some extensor lag when she does a single leg raise, so it means her quad isn't completely firing. And so today we're going to do a biphasic pulse current using the electrical stimulation machine. And the purpose of that is we're trying to activate her quad and try and connect her neuromuscular connection so that she can fire it on her own. And we went over this in our initial eval, but some contraindications for electrical stimulation for NMES is any type of blood clot, which could happen post-surgery, but she seems to be looking good. Surgical incisions, we have to make sure that we don't place the pads on any of those, and so far they look pretty good. Other than that, she's not pregnant. We also checked her sensory in her legs, and so she has good sensory feeling. So I'm gonna go ahead and ask the patient. So we're gonna do the electrical stimulation machine today on you. So I see that you've been having trouble firing your quads on your own, and so this will help try and fire them for you, but also try and get you to relearn how to contract that muscle again. If it's okay, I'm gonna place these on your quad.
Okay.
All right. So the first one I'm gonna put right above her knee, making sure there's no surgical incisions there. And then one about upper thigh. And so I put these here just to try and get as many motor end plates as I can to get the muscle contract. And then I'm gonna turn the machine on. And so I'm gonna go to biphasic. We're gonna keep it at a normal setting. And I set the timer for 10 minutes and at 10 seconds on, 30 seconds off. So that means she'll get 20 good contractions in this period of time. And then I'm gonna set it up to 1.0 ramped just so it gives some time to contract the muscle, but also not shock the patient too much. And we're keeping the rate at 50 pulses per second. And so that'll give us a nice smooth contraction with the muscle, so it's not too jerky. And then the pulse width, since she's starting for the first time today, will be at 200. And if we do need to change it in the future, we will, but this is the minimum amount that we would use. Okay, so I'm gonna turn it up. Just let me know first when you feel it. And then from there, we're gonna try and get a good contraction. So we need to see that in your quad. So it will be a little bit uncomfortable, but just let me know if it's too much, okay?
Sounds good.
All right.
I'm starting to feel it.
You're starting to feel it? Okay. I'll turn it up a little bit slower. I want to make sure we see that quad contract. Oh, there we go.
There's the contraction.
All right, so we're gonna start it, and I want you to push down into this towel as hard as you can. Go, go, go. Good. We're seeing that nice contraction in the quad so far. After 10 seconds, you can relax for 30 once the machine stops. Good. So we're just gonna kind of wait 30 seconds. And is that feeling okay for you?
Yeah, feeling
That was a
good.
good contraction? Okay, and again, I turned the ramp up a little bit more so that it doesn't contract too quickly and shock her, especially since this is her first time. And we're just gonna wait. It should be coming soon.
There it is.
There you go. Yep, push it. There you go. So yeah, we can see it contracting still, which is good. Good. And for the sake of this video, let's stop it at 10 seconds. Okay, so we're taking these pads off, and so far her skin looks good. No redness or irritation there. How did that feel for you?
It felt good.
Good. So we'll probably progress this during treatment, and then as soon as she's able to fire her quad on her own, then we can stop this and move forward.